People around the country have plans to enjoy the sunny, warm weather that's expected this bank holiday. Well, let's speak now to Bharat Pankania, an expert in disease and infectious disease management. He joins me live from Bath this lunchtime. Good to talk to you as usual on Sky News. Quotes from one of your colleagues to say that with the new Indian variant, things could get bad very quickly. What do you think?
Yes, I am concerned, and I'm concerned especially for people who are yet to be immunized. Even the one dose of the vaccine is protective. It's better than nothing. The concerns with the variant is it is more infectious. At the moment, we know that it probably isn't more disease causing. And the good news also is that it isn't bypassing the vaccine. But because it is more infectious, it could infect you with minimal effort. And that is where we need to be careful.
Do we have a full picture of transmission within schools? Because there was some data that was expected that then didn't appear as expected. Do we need to know more about that?
Yes, we do. And I think we need to grasp the nettle and accept that transmission of infection does occur in schools. If we look at the previous heat charts, it started with the younger age groups, it moved on to the parents, and then it moved on to the grandparents. And we are failing to accept that, whilst young children may not have severe illness, they do get infected and they do transmit infection. And therefore, we need to double up our efforts as soon as we can to also immunize the younger age groups.
From what age would you say?
I would go from wherever the licenses are. So there is no reason to suddenly say that this is a demarcation that below 12, I'm not going to immunize, etc. Wherever the license is, we have to follow. And I note that Pfizer has now licensed the vaccine for 12 and above to get their vaccine. And I think that is a move in the right direction, because when you immunize the young people, the benefits are that they are protected. That's one. The second thing is they become less of a secretor, less infectious if they were to pick up the infection. So the benefit is twofold. One, they are protected. Schools, colleges, universities are made safer. And two, they infect fewer people because they release fewer virus particles. So it's a good thing to do.
One of the big concerns that's been there since the start of this pandemic, of course, is the fear of overwhelming the NHS. Who are the people who are going to end up in hospital with this variant? Because most of the vulnerable people have been vaccinated.
So we have a conundrum here, which is the people who are not immunized or have not mounted an immune response. So there will be a proportion, let's say 10 to 15% of the fully immunized who still remain vulnerable. So that's one group. And the second group are the people who are not immunized at all. I am positive and hopeful that our National Health Service will not be overwhelmed, because now the UK has got a substantial population fully immunized or partially immunized. But because we've got a variant which is more infectious, you could see the younger age group who have yet to be immunized becoming ill, and a proportion of them will end up in hospital. But the better news is, because they're younger, fitter, don't have other pathologies, hopefully most of them will not have severe illness leading to wanting ITU support or ventilation.
Some have expressed concerns about the full unlock on the 21st of June. What is your view on that? Because most of the restrictions that existed for individuals and individuals' behaviour have already been lifted. So what is the big concern about June the 21st? And if there is a concern about June the 21st, do we also need to look at the easing of restrictions that's already taken place?
Yes, I think there are a few grey clouds with respect to June the 21st, which is only a few days away. So we have in parts of our country hotspots, and the hotspots are quite a rising tide of infections with the variant originating from India, and it is causing infections. I appreciate that it is not causing lots of hospital admissions, but we need to bring the infections under control in those regions. I'm talking about Lancashire, East of England, Midlands, etc. If we don't, then we will have to have a regional approach. Otherwise, all bets are off on the 21st doesn't apply, because you have a variant, but you haven't got a population that's fully immunized. Therefore, you would get a rise in number of cases if you said on the 21st of June, no more restrictions.
All right, Mr. Pankania, always good to talk to you. Thank you for your time this afternoon.
Thank you.